Lillian, I want to expand on what you just said because it's so important. We see this in all the patients we assess in the neuropsychology service who have MS, who are referred to us at various stages of the disease. The psychological and mood impacts are really quite profound. The dysphoria associated with having the disease and the reaction to the diagnosis, the cognitive symptoms that you described about interacting with things like fatigue and pain. It's critically important that providers like us really continue to learn, I should say, to listen to patients. And it's really important that we acknowledge these invisible symptoms, the cognitive, the psychosocial, the mood symptoms that accompany MS. So Lillian, how is your relationship with your provider? And tell us all why it's so important.
I have a great relationship with my provider. She educates me on the latest treatments and the latest research that's coming up. She collaborates with me. She makes me, the patient, part of her team. It's not a passive role. She gives me options as far as treatments and then lets me decide. And but the most important thing is that my provider really listens to me. When I'm in that exam room with her, it's like she shuts the rest of the world out, and I am the only person right then that she is thinking of.
So Lillian, what are some of the, I don't know if it's recreational or fun particularly, but the things you do to try to adapt to your situation to enhance your quality of life?
Okay, well, I practice meditation every morning. I do gentle chair yoga and then stretching, and then I try to walk a little bit every day. I used to be a big walker, and now I can't do that anymore. I go with the cane now, and I'll go 1 block and come back. But I'm always trying to find balance because MS took so much of who I am away. And so I try to live in the moment and not worry about the future. And I play my classical guitar. I knit.
Mm-hmm. Sure, so now I'd like to address in a little bit more detail the cognitive and emotional aspects of the hidden symptoms of MS, which you introduced so eloquently, right? In terms of emotions, MS has critical impacts on mood, and it is the mood symptoms of MS are both biological in nature and reactive and psychosocial in nature. We believe that the lifetime prevalence of mood problems in patients with MS is roughly 25 to 50%, which is an astonishingly high figure. That's 2 to 5 times what we see in the general population. Depression is a critical aspect of MS. It can increase rather dramatically in the immediate aftermath of the diagnosis. There is some evidence that it is related to brain abnormalities, particularly in the left temporal area, but also in a number of other cortical and subcortical parts of the brain. One of the, I think, most problematic parts of dealing with depression and anxiety, because they really exist on a spectrum in MS, is that perhaps the people around you might say, well, okay, we've heard this, so get over it, get back up and just keep going. And of course, even though maybe there's an outbreak of depression in the immediate aftermath, in fact, it doesn't go away, as you've said so well, really. Now, to add a little bit more about the cognitive symptoms of MS, here again, lifetime prevalence reported to be between 45% and 60%. Again, a remarkably high rate in comparison to the general population, and in many ways just as invisible as the mood symptoms. You're a beat slower. It's hard for you to multitask. It's hard for you to shift between one thing and the next. To be a little bit more academic about this, what do we look at in terms of neuropsychological assessment of the symptoms of MS? We look at psychomotor speed, processing speed, those are interrelated, hard to extricate from each other. Cognitive efficiency, how efficiently you're able to engage and complete a task. Sustained attention, right, which is in some ways the simplest kind of attention, but also more complex attention, shifting between one thing and another, screening out distractors, planning ahead, showing mental flexibility when the situation demands it. And of course, again, all of these struggles for someone with MS are intertwined with what Pat was talking about, fatigue and pain, right? If you're effectively, being just exhausted by the process of living through your day by maybe mid-afternoon, right? You're not going to be as capable of doing the things you did in the morning, but even the things you did in the morning, you're doing them differently than you were 15 years ago. So I can really see how those difficulties would impact you in a way that's not immediately visible to those around you. The other thing I'd like to add that's really important is brain reserve, also called cognitive reserve. It's pretty well known at this point that what you have walking into a disease like MS is going to have an impact on what you have walking through it. So the healthier you were, the more cognitively active you were, the more physically active you were when you got sick, that's going to enhance your adaptation to the disease as you go along. It's not going to make it go away, but it is going to make you more able to cope. And of course, there's an overlap between cognitive symptoms, depression and anxiety, fatigue, pain, and the other physical symptoms of MS. They are all mutually exacerbating, right? So those are the kinds of things that interact with each other that MS patients struggle to deal with. This is what we know about cognitive enrichment, and I should say also physical enrichment, and all kinds of disorders, including MS. We know, number one, that doing your best to remain physically active, however modestly, is really critical. That's a huge mood enhancer, and it also helps you mitigate the cognitive struggles that you have with MS. Number two, being around the people you care about, the people you love, socializing, psychosocial involvement, turns out to be a very, very important mitigating factor with cognition and mood in MS. Cognitive enrichment, the findings have been mixed. However, there is some indication that remaining cognitively challenged, say you mentioned playing your classical guitar, learning a new piece, right? Pushing yourself in a way that you haven't done before, right? That does seem to enhance cognition. And Dr. Coyle, my understanding now is that gray matter, particularly cortical lesions, are very strongly predictive of cognitive dysfunction in MS.
That's exactly right. You're looking at cortical atrophy, thinning, and to a lesser extent, deep nuclear gray matter like the thalamus thinning. That has really been correlated with cognitive issues.